Hello everyone, this is Kumar Mohit. I'm a student of medicine here at University of Perpetual Health System Delta, Jonelda Foundation School of Medicine in Philippines. Okay, so today I'm going to demonstrate to you how to examine the all 12 pair of cranial nerves. So I'm going to demonstrate that in front of you. We will take it one by one. So as we all know that we have total number of the 12 cranial nerves, means the 12 pair of the cranial nerves. So we will start by the first one. So without consuming any time, we are going for the first cranial nerve. That first cranial nerve is the olfactory cranial nerve. So for that, olfactory, as we know by the name, that the olfaction means related to the smell. So what we are going to do, we will just demonstrate on our patient. We will just offer them, or we will close their eyes, and we will give some some items that have a different fragrance, aromatic fragrance, and we will check out that familiar object they will able to recognize it or not. Okay, so let's go. I'll introduce you with my patient first, and then we'll start the demonstration. So here is my friend who gonna be patient for this demonstration. So would you please tell me your name and age?
My name is Kumar. My age is 22.
Okay, so do I have permission to check your all cranial nerves?
Yes.
Okay, so today we're gonna access some of your neck and head part. Okay, face part. Is it fine for you?
Yes.
All right. So we got the permission. Now we are gonna demonstrate the first one. That first one is the cranial nerve 1. That's the olfactory. First of all, we have to ask our patient that did they have any kind of the cold or something, any kind of the viral disease. So did you have cold
No.
before this? No.
No.
And what about now?
No.
It's fine.
Yes.
Okay, let me check. Breathe in and breathe out. Okay, this one. Okay, it means the nostrils are open. You have to just close your eyes. Will you please remove your specs? Okay, thank you. Now please close your eyes. And I'm gonna just offer you something, and you have to smell it, and you have to tell what's this. Okay. So we have this today. So as you know, what is this?
It's lemon.
Okay, so he recognized it. You can open your eyes now. Okay, so this one was the first one. That's for the olfactory nerve, cranial nerve now. So we have done with that. Our patient is completely fine. Cranial nerve 1 is completely fine. Now we are going for the second one, and second one is the for optic nerve, as we all know. Now for the optic nerve, we have some series of demonstration, series of tests. So first of all, we are gonna do the vision acuity test. So for that vision acuity test, this is the central vision test. So for that, we have to use the Snell's chart, and we have Snell's chart over there. The distance from the patient to the Snell's chart should be almost 20 feet, and we have maintained that. So now we are going to ask our patient to close their one eye and just read the smallest line from the Snell's chart, what he can read. Okay, and we will find out the vision acuity from there. Okay, so will you please read that letter, smallest line?
E D F C G P.
Okay, so you can't read below that.
No.
Okay, from this one.
E D F C G P.
Okay, so it means his vision acuity is 20 by 50. Above the green line, he was able to read it. So that's fine. And if your patient is not able to read it properly, and they have the difficulty while reading, then we can do the another test. That's the pinhole test. We can just put one hole, small hole in the card, and that will just increase the vision. Okay, so that was the vision acuity test for the central vision. Now we will go for the another test, that is the finger wiggle test, and that's for the peripheral vision. We have to find out the vision field of vision, that up to what distance he is able to see around them. Okay, so let's go, and we are going to do the second test, that's the finger wiggle test. So for that, I'm just sitting here. You have to just tell me whenever you will see my fingers. Okay, okay, I'll move that. So you have to look at me. You have to look at me. Go.
Yes.
Okay.
Yes.
Okay. For this one.
Yes.
Okay.
Yes.
Okay. So that was for the field of view, means how much area his eyes are covering. Okay. So this one with the finger. We have done with the optic nerve examination, means the cranial nerve number 2. Now we are going for the cranial nerve number 3, that's the oculomotor nerve. And here for the oculomotor nerve, we have to just demonstrate that pupillary reflex. So we have to just put this light, means we have to just flash this light in the eye, and we have to see the movement of the pupil. Okay, we have to see the symmetry of the pupil as well. Is there any blur, or is there any their edges are the clear or not? Okay, so let's go. And so first of all, we have to start this with observing the pupil properly. We have to make sure that our room should be darkened while we are doing this test. So now I'm putting the light in one eye, means I'm just watching the direct pupillary constriction or not. So let's see. Okay, so the pupils are constricting in this eye. Now we are going for the another one, that's the I'll put the light in this one, and I'll check that the same reflex is happening in this eye or not. Okay, so let's go for it. Okay, it means both eyes are in very coordinated way. Both pupils are working well. While I'm putting the light, they are constricting at the same time, and they don't have any kind of the defect in their symmetry as well. Okay, so that was for the oculomotor examination, and now we will go for the next cranial nerve examination. Examine the cranial nerve number 4 and the cranial nerve number 6. Okay, the sixth one is the abducens, and the cranial nerve number 4th is the trochlear. Okay, so for that we have to just do one pattern in front of our patient, like we have to form the edge, and now I'm going to demonstrate you, and we have to just look and properly observe the movement of their eyeball properly, means the extraocular muscle movements. Okay, so let's go and demonstrate it. So now what I'm gonna do, I'm gonna form edge in front of you. Okay, you have to just look at this top of my finger. Okay, here tip of my finger, and you have to follow it. Okay, so let's go. Okay, your muscle movements are completely fine. As we know, these muscles are these extraocular muscles. If there would be any defect, then the proper eye symmetry and the eyeballs would not move in a proper direction at the same time. So there was no defect, that his eyes are completely fine. So that's the test for the cranial nerve number 3, 4 and 6. We're gonna do now another test. You have to look at this finger, okay? And okay, so that was the convergence test. So convergence test is also fine with my patient. So now we are going for the next examination, that is for the cranial nerve number 5, and this is the trigeminal nerve. As we know, the trigeminal nerve is divided into the 3 parts, that's the V1, V2 and V3. So V1 is the ophthalmic nerve, V2 is the maxillary nerve, and V3 is the related to the mandibular nerve. Okay, so now we are gonna do this. So first of all, we are gonna do the sensory part of this trigeminal nerve. So for that we have this cotton bud with us, and you have to close your eyes, and when I'll touch your face by this bud, and whenever you will feel, then you have to say now. Okay, now. So please close your eyes.
Now. Now. Now.
Okay, so means all 3 parts are working well for the sensory one. So now we are going to do another, that is the part of the sensory examination, that's the corneal reflex. That's very important, that corneal reflex is regulated by the trigeminal nerve. So for that, what we have to do, we have to open our patient eye. Please open it completely. And we have to move this cotton on the cornea, and we have to check that normally it's happened that both eyes of patient blinks at a time. So that was for the corneal reflex. We have to make sure that we have to take the press code. Now we have to check the motor part. So for that you have to really please open your mouth. Open completely how much you can. Okay. We have to make sure the proper size of the mouth opening. Okay. Close your mouth. Tight your mouth. Okay. We have to check this mastoid muscle. Okay. Now you move it laterally, your lower jaw. Okay. Okay, that's working perfectly. So we have to check the movement of the jaw. We have to check the, you know, here is the mandible and the angle of the mandible as well. Okay. And is there any defect? We have to notice that. Okay. So that was for the trigeminal nerve, means the trigeminal nerve. That's the cranial nerve number 5. Now we are going for the next one, and next one is the cranial nerve number 7. That is the facial nerve. And for that, what we have to do, we have to check the face of the patient properly. We have to see for the any kind of the dissymmetry or any kind of the placia or any kind of the contour of the face and the facial muscles. We have to check is there any kind of the lumps or something on the face. Now we are going for the movements of the face as well. So will you please smile? Complete. Show me your upper and lower teeth. Okay, open your mouth. Okay, close it. Okay, will you please close your eyes tightly? I'm gonna let it open. Don't let me open it. Okay. Okay. Now will you please just make your eyebrows up again. Okay, please make puff of your cheeks like this and don't let me. Okay. Okay, it means their muscles are working nicely. Okay, so that was a perfect. We have to just notice the different kind of the expressions of the face and different kind of the movements of what they are doing at the time of the, you know, demonstration. So we have to notice that, and if there is any part of the, you know, face that is not working properly or that is, you know, lagging while they are raising up their eyes or raising up their you know, eyebrows or just complete closing their eyes, so we can just focus on that part. Okay, so that was for the facial examination, facial nerve examination. That was the cranial nerve number 7. Now we are going to examine the cranial nerve number 8. That's the vestibulocochlear nerve. So by name we can clarify it that it's related to the listening, means the ears. So for that we have been already done so many times the Weber test and the Rene test, and we have already done with the, you know, whisper test. We're gonna repeat it again. I'm not gonna explain that one. So I'm gonna just repeat some words. You have to just tell me what I have repeated. Okay, whisper. Okay. Okay. We have to close one ear and we have to whisper.
2, 3, 1. A, B, C, D, F.
Okay, so the whisper test is fine. Now we are gonna do the Weber's test first. So for that we should have one tuning fork with us, which we have 512 Hertz. So you have to tell me if the sound is in middle or left or right fluctuated.
Middle.
In the middle?
Yes.
So means the both ears are hearing properly.
Yes.
Okay. Now we are gonna do the Rene test. So for that we have to just put this tuning fork at the mastoid bone, means the behind the ear on the bone, and we have to just, you know, compare the conduction, means the bony conduction and the ear conduction. So let's go for it. Tell me when you stop hearing it.
It stops.
Are you able to hear it now?
Yes.
Okay, it means the air conduction is more than the bony conduction, so that's perfectly fine. Okay, so that was the for the cranial nerve number 8 in the vestibulocochlear nerve, which we have done. Now we are going to examine the cranial nerve number 9 and cranial nerve number 10. So cranial number 9 is the glossopharyngeal nerve, means related to the pharynx, and the cranial number 10 is vagus nerve. So for that we have to do some demonstration like this. We should have some instrument with us like our pen light, and we should have tongue depressor as well, because sometimes it's happen like that the tongue is just restricting our way to see, our vision to see the movement of the pharynx. Okay, so let's go and do it. So first of all, what we are going to do, we are going to see the patient's mouth properly and open it completely. Will you please open it? Open complete mouth. Okay, up. So you have to open your mouth completely. Okay, and let me see the pharynx inside. So because the tongue is restricting our way, so we have to use this tongue depressor. Will you please down the tongue? Okay, open it. Open your mouth completely. Okay, say ah. Okay, again. Now for the vagus nerve, we have to use the gag reflex. So for that, we should have one, cotton bud for that, like that, and we will just put this in the pharynx. Open it completely. Okay, we have to check the complete, pharynx and movement of the uvula, the symmetry, and then, will you please cup for me? Okay. Okay, do you feel any difficulty while doing this? No, it means he's perfectly fine. So the cranial nerve number 9 and 10, these we have been already. Now we are going to demonstrate you the cranial nerve number 11, that is the spinal accessory nerve. So for that, what we have to do, we have to see the structure from the back of the patient, structure of the spinal cord, and is there any kind of the deviation, any kind of the asymmetry on the body. So we have to look at this properly. Do you have any pain regarding the spinal cord? No? Okay. And what you have to do next, you have to just please turn around, and we have to tell our patient to please just raise his shoulders like this, and I'm gonna register you, and don't let me down it. Okay, you have to put control it. Okay, it means it's fine. And now the next one, what we have to do, we have to check the SCM, means the sternocleidomastoid mastoid muscle. Okay, so for that we know that here we have the SCM. So for that, I'm gonna just push you like this side. You have to register it. Okay. Okay. Now for this one. Okay, so we can check here. This is the SCM. Okay. So that was for the cranial nerve number 11, and my patient is perfectly fine for this. Now we are going for the cranial nerve number 12, that is the hypoglossal nerve. Hypoglossal means related to the tongue. So what we are going to do, we have to examine the tongue properly from the lateral side, from the up and down. We have to check everything. So for that, we should have this gauge pad with us, means this is a kind of a cloth. So we have to just catch the tongue with this, and we have to just see the proper the tongue from around. Okay, and the surrounded area. Will you please open your tongue? Okay, so check the tongue properly, the color, and for the interior we have to check. Open mouth properly. Okay, this one as well. Up, down, proper mouth. Okay, so it means his tongue is fine, and we didn't find out any kind of the deformities near the tongue or below the tongue or above the tongue. So this nerve is also absolutely fine. They are able to just move their tongue properly, so the tongue movement is that's all. We have been already demonstrated the whole cranial nerve from C1 to the C12. Okay, and I hope that makes sense. Thank you so much for watching this. Bye bye.